You know, troublingly, we are only in the early stages of this pandemic, but even so, doctors and hospitals are already running out of protective gear like those masks, the gowns, eye shields. The doctors in Georgia, take a listen to this doctor in Georgia. He's one of them. His hospital, though, has decided they need to get creative.
We've got an army of seamstresses making these for us in the community, volunteers, people from out of town. We've got more than 50 people making these right now. We think we can make 200,000 of them.
Literally sewing their masks together. Now, doctors and hospitals, they are waiting for more of those surgical masks. As Vice President Mike Pence said, 3M was making millions of them. Now, he made that announcement 2 weeks ago.
We're going to be working with members of Congress to see if we can ensure that all of what 3M creates here, some 35 million masks a month, could be available to our healthcare providers.
Give you a frame of reference. Things have gotten so bad. The CDC is saying that workers who can't get masks, I'm talking about doctors, nurses, can use bandanas or scarves as a last resort. The CDC also saying healthcare workers can keep working if they have mild symptoms as long as they have a mask. But of course, you have to have your hands on a mask to obviously fit that bill. Then there is confusion over a malaria drug that President Trump touted today as having the potential to fight the virus. Here he is this morning.
A drug called chloroquine. Normally the FDA would take a long time to approve something like that, and it was approved very, very quickly, and it's now approved.
But just minutes later, during the same press conference, the FDA commissioner said that drug would likely only be used in controlled trials to determine whether or not it even works and is in fact safe to use. He also said there is no timeline for when that would be approved. Then there is the issue of course, ventilators. We have been talking a lot about the looming shortage, and when things get bad, it is a huge concern, and it's being felt just about everywhere, but particularly right now in the state of New York. Take a listen to Governor Cuomo.
I believe the Army Corps of Engineers and the state working together can create more beds. The beds do me very little good without the ventilator. Just for context, where we are, we have about 5,000 or 6,000 secured. We need 30,000. Federal government has 12. I mean, this is a bad situation.
I want to bring in our guest, Dr. William Schaffner. He's a professor at Vanderbilt University School of Medicine in the Division of Infectious Diseases. So we've heard from hospital after hospital in our area, and certainly the leaders that are saying that the acute need for the ventilators and also the supply and safety gear, the demand is outplacing the supply. And while we're trying to get certain elements of those, as the amount of cases crest, hopefully after 2 weeks, maybe that changes, but certainly for the near future, we're going to be getting more and more patients. At this point, are hospitals resigned that kind of as Italy is dealing with this, we are too in a certain way that we will not have enough to deal with the patients and we're just going to have to make do with what we have?
Well, I don't think hospitals are resigned, but they've all dusted off their pandemic preparedness plans. I know that we have. We've made adjustments now, and we're prepared to make future adjustments. The shortage of ventilators and other equipment is not uniform across the country, so I think some places are going to be more stressed than others. And as we've all heard, listening to the news, that we may be getting some relief, ventilators and other equipment from the federal government, indeed from the Department of Defense. So we're all crossing our fingers, hoping for the best, and ready to do the best we can when the patients come to us.
How challenging is it, though, Doctor, when there is so many mixed messages? And I'll take one recent example. The Vice President saying that 3M, they're producing 35 million of these special masks that would be obviously critical for the hospitals in the front lines, but yet so many hospital administrators have turned in response to say, no one's told us that they're coming. We were told by the CDC even yesterday to start thinking about using bandanas or scarves in the ICUs. I mean, the messaging and the completely 180-degree directives they're getting from governmental agencies, I can only imagine how infuriated I'd be if I was running an ICU.
Well, there's no doubt that the messaging has been confusing, and generally from the federal level, I would say it's been from the sunny side of the street. But all of us are preparing for the shady side, which gets down to the nitty-gritty. And that clearly has us preparing. You know, at the moment, at least in our institution, we're doing all right. We are being very careful with our personal protective equipment. We're doing all right, but we know that the supply chain is uncertain.
To that end, what concerns you most, given this is your specialty, in that so many of the factors of this virus are still unknown, and also the changing face of the people that are the afflicted of this? We see the new numbers right now, and even China validating it. How many of the people were actually between 18 and 40, which belie the idea that it was overwhelmingly just the seniors, et cetera, or that children couldn't contract it. We're seeing, albeit limited numbers, but even some in that demographic. How much of this disease do we still not know, doctor?
Oh, well, there's lots that we don't know very much about it. And the information about middle-aged adults as well as children was anticipated by most of us in infectious diseases. These numbers that have just come out validate all that. So I think we've been preparing for this. But the thing that concerns me the most about all this mixed messaging has to do with our own healthcare workers. We know that a lot of them are confused. We're trying to do the best we can within our own institution in order to be coherent with our healthcare workers. But they're concerned. They're anxious, and we're trying to allay them and also provide them the very best information.
Doctor, you are far more, I think, cool-headed than me, which is a good thing. But I got to tell you, if I was, and I have family that are in the hospitals, if I found out today that the White House, my White House, was made aware of our lack of preparedness for a coming pandemic, and that they consciously got rid of a department designed to get in front of this, and then for 2 months largely twiddled their thumbs, I would be irate at that. There has to be some palpable level of frustration, not just at the mixed messaging, but at the lack of seriousness that this was approached with. And now the people on the front lines are facing the consequences, and obviously Americans coast to coast, as we're seeing in the numbers.
You know, I hear you. We have two outbreaks, don't we? One is of the coronavirus itself, and the other is coronavirus anxiety and concern and confusion. Both of those have to be dealt with. Most of us down here on the front lines are looking ahead at this point rather than looking back. And we're preparing ourselves for what is likely to be a very busy 2 or 3 weeks right in the immediate future.
And finally, when you're looking at the window, doctor, that we should gird ourselves for as a public, again with the multiple, and I'm not even attributing this to false information, but I know it's a moving target, where we thought that, well, you know what, this will peak, look at even China or even South Korea, we'll get over the hump once the curve is flattened. They're also giving warnings that, and if you go back, and I know you know your history, you go back to the Spanish flu, there was multiple hits to it. It wasn't one simple window where we got it. There was a second peak that was addressed to it too. Should Americans prepare to be dealing with COVID-19 for a year, or should they say that there'll be a return to normalcy hopefully as early as this summer?
Well, I wasn't instructed to bring my crystal ball, but looking forward more seriously, most of us in infectious diseases and public health anticipate that the COVID virus is not going to just disappear this summer. It may well go south of the border during their winter while we're having summer and cause illness there, and we wouldn't be at all surprised if it comes back in some sort of muted form this next winter. All the more reason to keep working on both therapies and vaccines.
And finally, an acknowledgement for the doctors, the RNs, that universally, even though there's concerns, keep trying to put a foot forward. I saw one physician who is right now quarantined, testing positive, but he said, it's a good thing because now I know when I get through this, I won't have a chance to infect everyone and I can get right back to the front lines. If there has ever been I think Exhibit A for maybe taking for granted some of the people who take their oath as seriously as they do. I think this chapter of history certainly has proven it. I'm sure you may have known it already, but this is one of the things I think that can come out of this is an appreciation for medical staffs.
Oh, your testimonial is so heartfelt and right on the mark. Let's all take off our hats to everyone who's giving first-line care, whether it's in assessment centers, emergency departments, on the wards, in clinics, wherever they are, taking care of patients. They deserve our gratitude. Thank you so much for saying that. Much appreciated.
Well, it is much deserved. Dr. Schaffner, thank you so much, and best of luck to you as well.
My pleasure. Thank you. Stay healthy.
We will try. Up next, a nation in crisis. But the president, he went on the attack today, and the target is the media, playing the blame game. After the break, we're going to show you what he said.